Hi everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about you feel very fatigued, you feel very weak, you have no energy, your bones hurt, your joints ache. What could be the problem? Now, remember, your body is made up of multiple organs. They're all like a symphony. When they all work together, you're healthy and you feel good, which involves mental and physical, both of them, right? So most important thing, very common reason of feeling fatigued is vitamin D deficiency. As we've become a more and more developed society, we tend to stay indoors. And as a consequence, we don't get vitamin D, which is in the sunlight. When we don't get vitamin D, calcium doesn't reach our bones, which makes our bones weak and we develop pain. Calcium deficiency. So if somebody doesn't eat adequate calcium or foods with calcium in them, you can have body pain, especially in postmenopausal women. Very, very common. It could be a thyroid related problem. If your thyroid levels are low, you could feel fatigued, you could feel pain in your body, so get that checked. You should have a health checkup done every year after the age of 30. That helps finding problems and addressing them at the right time. Fourth, if you live in a country where there's very little sunlight, mainly indoors, it affects your mind. When it affects your mind, it affects your body. When it affects your body, you start manifesting painful symptoms and have body pain. 5, generally a sedentary lifestyle. So if you're not exercising your muscles, if you're not moving your joints, they're going to hurt when they're made to do work. So it's like your car runs well as long as you're driving it. If you park it in your parking lot for very long, the engines get rusted and then they don't drive properly. The parts get rusted. So very important to be active and move your joints. You should also rule out arthritis in your joints. If there are pains in your joints, it could be because of a high uric acid. It could be rheumatoid, which are autoimmune problems where your body fights against itself and they can cause pain, or it just could be aging, which is osteoarthritis, which can lead to joint pains. So what can you do? Firstly, think positive, right? Think you're going to get out of this thing. Eat healthy. Make sure you eat a good balanced diet of carbohydrates, proteins and fats. There should be minerals, vitamins also, and at least a liter and a half of water, as long as there are no contraindications. Protein, how much? How much is too much? How much is too little? At least 1 gram of protein per kg body weight. If you weigh 60 kgs, 60 grams of protein every day. If you're a vegetarian diet, it may be a little challenging. You may have to eat more dals, etc. If you're non-vegetarian, it may be a little easier, but be careful not to overdose on proteins. It could cause a high uric acid. Develop the right routines every day, which involves flexibility-based exercises, strengthening exercises for your muscles. Both these are as important. And great simple exercises are swimming, cycling, to some extent jogging and running. But the older you are, close chain exercises like swimming and cycling are relatively better for your body. For strength and conditioning, some amount of weights helps. Body weight exercises like chin-ups, pull-ups, push-ups, they help. Taking regular supplements, which may mean a multivitamin, which may mean vitamin D once a month if your vitamin D levels are normal. If they're not, taking supplements to improve your vitamin D levels really help. Drinking enough water, at least a liter and a half help every day. And salts, very important in your body. So there's potassium in bananas, there's salts in lime water. So these things are good to have to make sure your hydration levels are maintained and the salts in your body are maintained. And they help a great deal because a lot of pains can be because of deficiencies of these particular things. Of course, lifestyle modifications, making sure that you have the right desk to work on, the right seating, the right bed, the right mattress, all these things matter. Most importantly, sleeping well. If you don't sleep well, you will have body pains because your body is not rested, it's overworking. If it's overworking, it speaks to you through pain, swelling, etc. So when do you seek medical help? When it starts bothering you. When these problems affect your peace of mind, your day-to-day living, please go see a physician, get yourself evaluated. If he feels it's an orthopedic problem, go meet your orthopedic surgeon. He will evaluate you, get some tests done to rule out these conditions. If there are any of them, he may give you supplements, he may give you medicines, injections, or just tell you, please change your lifestyle and get your act together vis-a-vis exercises, and that should help you a great deal. Physiotherapists are great people to go to for exercises in your body. So getting a good physiotherapist can help you make that initiation into doing right exercises and eventually a trainer. I hope you enjoyed this video. It gave you an insight about why bone pains occur, why joint pains occur, and what can you do, some simple home remedies to get better. If you liked this video, please like and subscribe to my channel, and please follow me on Instagram. Thank you.